Are you scrambling to teach your class online? If this is your lived reality, I can help. Today's topic, practical strategies to transfer Keith RN unfolding case study to a practical and powerful online learning activity. And this case study we're going to be doing is on sepsis, and it's a free download on my Keith RN homepage. And I have additional topics of unfolding case studies in my store, as well as all-inclusive topics that are only found in the membership, which I'll be discussing shortly. Now, as we look at case studies, did you know that case studies are one of the most effective strategies to teach a practice-based profession such as nursing, because it provides context and application. And with a case study, you can keep it simple. You don't have to have expensive technology and burden your students with additional activity fees. You can simply change the way you teach and to bring it online. And so the practical principles I'm going to share with you allow you to bring it not only online to innovate, but also innovate your classroom in the academic setting. One book I want to highlight is Designing and Teaching Online Courses in Nursing by Sally Kennedy. I've been blessed to have personal correspondence with Sally as she's reviewed my case study, and actually she has offered and has provided the guidance as an online instructional design expert. It was her feedback that's going to be the topic of this case study, that's going to say how you can break and chunk down an unfolding case study into some manageable bites that will really provide some discussion, discourse, and the creation of knowledge. So I'm going to share some big picture online strategies that you can use an unfolding case study to really rock it and bring clinical realities to your online classroom. Number one, you need to post your traditional course content online. I think most of you are doing that, taking your traditional lecture, putting it online for your students to view. Again, keep it short and concise, no more than 20 minutes. As you know, students begin to check out in your classroom in 20 minutes. They'll do the same thing online. As you look at the case study, choose what aspects you want to emphasize and highlight. So for example, any case study has holistic care priorities, has a nursing assessment, has then the emphasis of pharmacology, lab values. As you look at this case study, I want to give you the kind of the context that you can look at this and to decide what you would like to emphasize for your content based on what you teach. If you're going to use discussion board, which I highly recommend, you can simply use this case study to provide the context of about 3 discussion board questions as a sequence every 2 to 3 days, or however frequently you would like to post. And in essence, I'd encourage you to use the ability to hide the responses of the case of the discussion board until the student responds that first. So they're not looking at other answers and responding to at least 1 or 2 other posts in their small group of about 3 to 5 students, and taking your class and chunking them into meaningful small group discussions, just like you would do in the traditional online environment. And as you look at chunking a case study, you want to basically bring 2 to 3 questions every 2 to 3 days and use 2 to 3 distinct posts over the course of a week, or up to 4 posts over the course of 2 weeks. And so one case study can provide up to 1 to 2 weeks of meaningful learning and really kind of highlighting what you want to emphasize in that aspect. And so as you look at a traditional, breaking a case study down into 4 chunks. First post, start Monday morning, opening scenario, initial vital signs. Then ask the following 3 questions. Based on the information you've gathered, what's relevant and why? What is your patient likely experiencing or feeling right now? What can you do to engage and show that this person matters to you? And then based on the data you've gathered so far, what body systems will you assess and what are you looking for? Your second post, have your students reflect on that, identify that information, and then post it, and then dialogue in the small group. And you as faculty can interject and respond and facilitate that discussion. Post number 2, nursing assessment. Then the lab values and diagnostic results, and then ask the following questions. Interpreting the clinical data already collected, what are the priority problems in the order of importance? It's using that aspect of interpretation. You've noticed this data. Did you notice correctly? Now what's your interpretation of this data? And now put it all together. What's the problem? Priority problem, what's your nursing priority that will influence how the nurse responds to a plan of care? And then what's the worst possible or most likely complication to anticipate based on the primary problem? These are all clinical reasoning questions that are required to make a correct judgment. Third post involves care provider orders. What does the doctor order to manage this problem? And then have a discussion board post under this sequence of stating the rationale and expected outcomes for the medical plan of care, and then determine what order of several does the nurse implement first with rationale. And this is an NCLEX question. It's also a practice question that your students must understand. And then finally, for the fourth post, you have the evaluation or the unfolding change of status with vital signs and nursing assessment data. And you ask the following questions. Does the objective data correlate with the exam findings? If so, in what way? Has the patient status changed? Is it improving, declining, or reflecting no change? Reflect on your thinking. What did you use to complete this case study? What did you learn from it? And how will you apply caring and learning for future patients? So now I want to make it practical and go right into the free download that's currently on my case on KeithRN on my website called UTI Urosepsis. Now you don't have to put the title on it. Let the students, they put the image, but you don't prompt them to what the problem is. And here is the scenario, and we're going to walk through this and kind of show you how you can take this free case study, and all of my unfolding case studies have the same structure, and how you can make this a meaningful online course class activity in your program. So Jean Kelly is an 82-year-old woman who has been feeling more fatigued the last 3 days and has had a fever the last 24 hours. She reports a painful burning sensation when she urinates, as well as frequency of urination the last week. Her daughter became concerned and brought her to the emergency department when she did not know what day it was. She's mentally alert with no history of confusion. While taking her bath today, she was weak and unable to get out of the tub and used her personal life alert button to call for medical assistance. She lives independently in a senior apartment retirement community and is recently widowed and has 2 daughters who are active and involved in her life. And so as you look at the first post of discussion board questions, from the information you've gathered, what relevant data needs to be noticed by the nurse, looking at her weakness, fatigue, new onset of confusion. You can look at this and determine this is recognizing what's relevant and why. And then looking at the second question, what's your patient experiencing or feeling right now? This is where, if you're fundamentals, you can go deep with holistic care and what that looks like. And then based on the data you've gathered so far, what body systems will you assess and what are you looking for? Again, anticipating what's my potential problem, what am I going to do? These are all basic reasoning questions that will translate into not only the online environment, but also into practice when they return to clinical. Post number 2 is now focusing on nursing assessment. Here's her general appearance. She's uneasy in bed, changing position frequently. Her breath sounds are clear. She's pink, warm, and dry. She's alert and oriented to place, and her abdomen is soft and non-tender. Bowel sounds are audible per auscultation. She's voiding without difficulty. She's got her knees swollen bilaterally, warm to touch, decreased range of motion. What could that possibly mean? And so again, we look at the diagnostic data. Her chest x-ray, she has no infiltrates or other abnormalities, no changes from her prior. Her lab values, you can see her basic metabolic panel. Her creatinine has climbed from 0.5 to 1.5. Her CBC is climbing up slightly from 9.5 to 10.5. Her hemoglobin is slightly anemic, but yet not a critical finding. You can see exactly where she's at. Her urinalysis, you can see the results there. And again, you're having students identify what is relevant and what is the clinical significance. Here's her UT, here's her urinalysis. You can see she's got cloudy urine, she's got positive protein, she's also got a large amount of bacteria, and her white count micro is greater than 100. What's the clinical significance and what does that represent? As well as her lactate is 3.2. And what does that represent as it relates to lactic acidosis? And so now our second set of questions with the discussion board is interpreting the clinical data, prioritize the most likely problems by order of importance. So now we're kind of saying, what could this be? Do we have a UTI? Do we have sepsis? Or a combination of the two? And again, kind of looking at what those problems could represent. What is the nursing priority and the goal with how to formulate and respond to a plan of care? What's the worst possible complication? We could be sliding into sepsis, going into septic shock. And so now we have the medical management orders. We have the doctor orders a peripheral IV, a fluid bolus, aspirin, ceftriaxone, and morphine. What's the rationale for that? And the expected outcome would be, again, in your next discussion board post. And then deciding what does the nurse implement first is number 3. Finally, you have the evaluation. You've done all of these orders. Her temp is still 101.4. Her pulse is 118. It was 110. Her blood pressure has gone from 102/50 to 94/50, still setting well 98%. Again, clinical reasons, identifying those trends. Where is this patient going? And is it going in the right direction, or do we have a problem? And again, we have a problem with certain aspects. Her blood pressure is sliding, her heart rate's increasing. She likely needs more fluids, may even need vasopressors if that does not solve the problem. And then we have our nursing assessment. We have her breath sounds are clear. Her color is now, her color is flush. She's warm and dry. She's alert and oriented times 2. So now she's got cementation issues, as well as her abdominal is soft, non-tender, and has had no urine output the last 2 hours in the emergency department. Is that a concern or not, especially if she's gotten fluids? And so again, your students have to reflect and identify what clinical data is significant and why. Does it correlate with the exam findings? And has the patient status changed? Has it improved or not? And then reflect on your thinking. What did you learn? How will you apply and learn caring to what you've learned for future patients? And so again, all of these steps and questions represent a step of the nursing process and a plan of care in the clinical setting. So if you found this helpful, I want to encourage you. You can bring clinical salience to your online environment. And I have a membership that provides over 100 case study topics across the curriculum with multiple levels of complexity. They're simple and old school, but they're easy to implement. So check the link and see it for yourself. And as we look at the current coronavirus pandemic, it's an unforgettable object lesson that nursing education must make it a priority to develop clinical judgment. And these case studies can help bring clinical to the online environment. Plus, once you're back in class, you can use them to better prepare your students for practice and licensure, including Next Gen. Thank you.